like to say good morning to everyone and also to our listening audience, and also want to thank the media for being here as well. We're here to give an update on COVID-19. I wish we were not doing this press conference. We've been battling the COVID-19 since March of 2020, but we're still in this fight to finally defeat COVID-19. Just kind of give you a couple of updates on where we are. On starting on tomorrow, Tuesday and Wednesday of this week, the vaccination site at Legion Field will be open from 10 a.m. to 6 p.m. Also, we've had some of the ticket incentives that will continue on tomorrow. The event that will be this weekend at the VJCC concert hall. The promoter has provided additional tickets for those residents who will come and receive a vaccination shot and request a ticket to the concert this weekend. That's with Will Downing, with Peebo Bryson, and others. We want to, while supplies last. Last week, the City of Birmingham, Mayor Wolfen issued a mask ordinance for those residents engaging or entering any city facility. And so we want to remind everyone to please wear their mask as they enter any city facility. It's City Hall, Boutwell, any of our libraries, recreation centers, Museum of Art, Botanical Gardens as we move forward. Also, a lot of conversations on why are we here. We're here because we need to increase the number of residents being vaccinated substantially. As you know, Alabama is ranked last in the number of residents being vaccinated here within the state of Alabama. More specifically, within the city of Birmingham and the Jefferson County area, we've vaccinated anywhere from 35 to 37%. So we have a lot more work to do. As you know, President Biden issued a challenge for us to reach herd immunity, which is 70% by the 4th of July weekend. We did not meet the goal of the president, and that is why we're at this point where we're in a race against time. So we're reaching out to everyone to say, please, please, please go get vaccinated. This is about life and death at this point. We want to do everything that we can. Starting this week, we'll be running public service announcements on various radio stations. We're doing robocalls. We are throwing the kitchen sink at COVID-19. As part of our American Rescue Plan, we've identified $1.5 million for the COVID-19 response efforts. And as you know, the city of Gaston and also with the state Department of Public Health has instituted various incentives, that being TikTok, in Montgomery through the State Health Department, but also with the City of Gaston offering $100 for cash incentive for those that will be vaccinated. So we're closely monitoring those two models to see if that's something that we can bring here to the City of Birmingham. So with that, just want to kind of give an update on where we are now. Last couple of days, we're trying to figure out what could we do. So we reached out to a lot of the organizations here in the medical profession, but also from the fraternities and sororities within the city of Birmingham. So I want to thank you all for here and answering the call of all of us working together. I think that is the only way we're going to be able to finally defeat COVID-19. It's going to take all of us working together. So we're going to be working on a lot of creative, collaborative efforts. And so over the next couple of weeks, also, I'd like to invite everyone this evening at 6:30 to our Facebook Live Word on the Street conversation. We'll have medical personnel from the Jefferson County Health Department, from ARMS community with Dr. Clayton and Chris Mosley. Also, Ms. Dodger Hendricks, President of Birmingham School Board, District 4. Dr. Lindsey, you'll be taking part of that. Also, Dr. Martha Dawson, who's the president of the National Black Nurses Association. So we want everyone to tune in at 6:30. They can tune in to the Birmingham City Council's Facebook page. So we'll be answering questions and having dialogue and getting the latest information from all our different medical partners. So with that, I just want to kind of give an update on where we are, but I just want all of the organizations to come up and say a few words. And so this is a collaborative effort. This is just the beginning, not the end. and we're going to finally defeat COVID-19. So it's going to take all of us working together. So Dr. Harris, you want to come on up?
Good morning. Thank you, President Parker, for providing this opportunity. My name is Lindsey Harris. I'm the president of the Alabama State Nurses Association. Recently, numbers show a little over 34% of the Alabama population that are fully vaccinated. The American Nurses Association, along with the Alabama State Nurses Association, continues to encourage all individuals to be vaccinated against COVID-19 and to follow the recommendations such as wearing your mask, social distancing, maintaining the proper good hand hygiene, and other recommendations from the public health officials as new cases of a highly contagious Delta variant surge in many communities. Vaccinations are one of our greatest public achievements and are critical to continue stemming the spread and resulting disease, disability, and death related to COVID-19. We strongly recommend that all registered nurses, healthcare workers, and public be vaccinated against COVID-19. There's a significant clinical evidence on the safety and effectiveness of the 3 approved COVID-19 vaccines being administered under the Food and Drug Administration emergency use authorization process. We urge you to stay safe and protect yourselves and others. Thank you.
Thank you, President Parker, and thank you, Dr. Harris. Hello, I'm Boardlawn, the president of the Birmingham chapter of the American Association for Men in Nursing. The purpose of our organization is to bring health issues specific to men and to advocate for improvements to disparities in health. The recent trends of coronavirus infections are alarming. This virus continues to impact our friends, family, loved ones, and community. This does not have to happen. We have the tools and knowledge to change this trend. COVID-19 vaccinations are safe, and most importantly, they work. We stand in unity with our colleagues, health professionals, and organizational leaders to move our community in the right direction by advocating for vaccines. Be the leader within your community and advocate with us. We can move beyond this devastating virus by being vaccinated together. Thank you.
Good morning, everybody. My name is Gabriel Sapalaran Jr. I'm the current president of the Philippine Nurses Association of Alabama, and I'm a Filipino-American nurse. And President Parker, thank you for this opportunity, and I want to thank our colleagues who are joining me here to encourage everyone to be vaccinated against COVID-19. The Asian American Pacific Islander group are disproportionately affected by this COVID-19, more so with the access with the vaccine. However, our government are doing their very best to get these vaccines to reach out the Asian American population. In more so the PNA America, our national association that represent 4,000 members in the entire America, that trickles down now to Alabama, want to reach out with our community, the Filipino-American community, to get out there and be vaccinated. And we know that the growing body of evidence indicates that people that are fully vaccinated with the COVID-19 vaccines are less likely than unvaccinated person to acquire the COVID-19, to transmit it. However, if you're vaccinated, but if you're mingling with other community that are not vaccinated, the risks are very high. So I urge you, in Tagalog, inaanyayahan ko po kayong lahat sa aking kapwa Filipino-American na andito sa Alabama at lalo na sa Greater Birmingham na lumabas tayo at maging bahagi at tanggapin ang vaccine ng COVID-19. para mapreventahan ang seryoso ng ganitong kondisyon. Again, we all can work together, and on behalf of the Philippine Nurses Association of Alabama, stay safe, Birmingham, and roll up your sleeves and get vaccinated. Thank you. Gabriel, Gabriel, Sapalaran, Sapalaran, President of the Philippine Nurses Association of Alabama. Thank you.
Hi everybody, my name is Grace Grau. I am the founding president of the National Association of Hispanic Nurses here in the state of Alabama. I am honored to be here joining my colleagues and government officials of Birmingham to speak to you about the importance of getting vaccinated. As you know, only 5% of Hispanics in Alabama have been vaccinated thus far. And why is this? Well, the industries that have been hit the hardest by the pandemic are those in which Latinos are mostly employed in. According to the Kaiser Foundation, as of July 19th, less than 1/2 of Hispanic people have received at least one of the COVID vaccine doses. What does this mean for our communities? This means that we are at risk not only to contract COVID-19, but we have 2 times more likely to contract the COVID infection, 4 times more likely to be hospitalized, and 3 times more likely to die of COVID-19. More importantly still is that if you have not been vaccinated, you're at risk to contract not only COVID-19, but one of the 2 variants which currently are worse than the original COVID-19. Now, as we get ready for our children to go back to school, I have very grave concerns because a lot of the children are not eligible for COVID vaccines. And that means that if they are exposed to individuals that have not been vaccinated, that have either COVID-19 or a variant thereof, then they are at risk not only for an infection themselves, but to bring it back to their family members who may be immunocompromised or elderly and at risk. So I urge you to please consider getting your vaccinations. There are 3, they work, and when you look at the risks associated with COVID, those outweigh the risks associated with the vaccine. Los hispanos y latinos tienen casi 2 veces más probabilidad de contraer el COVID-19, 4 veces más probabilidad de ser hospitalizado y 3 veces más probabilidad de morir de COVID-19. Las industrias que se han visto más afectadas por la pandemia son aquellas en las que los latinos están empleados. Según la Fundación de Kaiser, desde el 19 de julio, menos de la mitad de hispanos, latinos, americanos recibieron al menos una de las vacunas de COVID. En Alabama, solo 5% de hispanos han sido vacunados. ¿Qué significa esto para nuestras comunidades? Esto significa que estamos a gran riesgo no solo de contraer el COVID-19, pero uno de los variantes que existen de COVID y de ser hospitalizado o de morir. Además, corremos un riesgo aún mayor si no ha sido vacunado, y esto es que sus niños van a regresar para el colegio y esos niños pueden ser expuestos a personas que no han sido vacunadas, que tienen el COVID-19 y lo van a traer a las casas más personas van a contraer esta enfermedad. Por lo tanto, yo estoy aquí hoy con mis colegas para urgirle que por favor sean vacunados lo más antes posible para protegerse a ustedes, a sus familiares y a nuestra comunidad. Muchas gracias. I urge you as the founding president of the Hispanic Nurses Association, Birmingham, please, Alabama, please get vaccinated. Thank you. My name is Grace Grau. Grace, Grau. Thank you.
As everyone remaining, if you would say your name and spell it for for the media is that. Just move, if you can say your name and spell it when you come up to the podium.
All right. Good morning. Good morning. My name is Aileen Nash. That's ALEAN-NASH. I am the president of the Birmingham Black Nurses Association. I do want to say thank you, President Williams, for inviting us for this conference, this press conference. Thank you. Now, the Birmingham Black Nurses Association, we've been in Birmingham for over 30 years. So we know Birmingham. Actually, we know Alabama. So we want to encourage all of those that are hesitant to get the vaccine. We've been in the community giving vaccine. We've been visible giving those vaccines. So again, we want to encourage those that are hesitant to get the vaccine. Now, those who have had the vaccine, we want to encourage you to encourage your family, friends, and your fellow co-workers to get that vaccine. Vaccine is needed. We have a lot of people that have passed on. Let's stop that. Let's encourage those family, friends, and fellow co-workers to get the vaccine. Thank you, Birmingham. All right, thank you.
I'd like to say good morning to everyone. And hello, my name is Ransom Davis Sr. Y'all need the spelling of that. R-A-N-S-O-M-D-A-V-I-S, and senior, not junior. Okay. I'm here representing the Omicron Lambda Birmingham chapter of Alpha Phi Alpha Fraternity Incorporated. My president, Darren Allen, who is out of the city on a family matter, so I got this at the last minute. I want to thank the councilman for having this event so we can inform the people of Birmingham and Alabama of our dire need. Alpha Phi Alpha strives to provide credible information to our brothers, their families, and the public to help prevent or slow the spread of the infection during this coronavirus pandemic. Currently, major urban cities are experiencing a disappropriate African American death tolls. We believe you need to know the facts from COVID, from the CDC on COVID-19 vaccines. COVID-19 vaccines are safe and effective at preventing COVID-19 disease, especially severe illness and death. COVID-19 vaccines reduce the risk of people spreading the virus that causes COVID-19. You may have side effects after the vaccination. These are normal and should go away in a few days. It typically takes 2 weeks after vaccination for the body to build protective immunity against the virus that causes COVID-19. You are not fully vaccinated until 2 weeks after the second dose of a 2-dose vaccine or 2 weeks after a single-dose vaccine. Learn how to find a COVID-19 vaccine so that you can get it as soon as you can. After you are fully vaccinated, you can resume activities that you did before the pandemic. Alpha Phi Alpha in Birmingham, Alabama encourages everyone that can be vaccinated to do so to protect yourself and your loved ones.
Good morning. I am Leah Wiggins, Leahwiggins, President of Omicron Omega Chapter of Alpha Kappa Alpha Sorority.
I am Vanessa Wilson, MANESSAWILSON, President of the Upsilon Eta Omega Chapter, Fairfield, Alabama.
I am Betty Wells, BETTYWELLS, President of Phi Alpha Omega Chapter, Birmingham.
Alpha Kappa Alpha Sorority Incorporated is a service organization that was founded on the campus of Howard University in 1908 in Washington, D.C. We are the first Greek letter organization founded for and by African American women, college-trained women. AKA continues to implore our members and the communities that we serve to adhere to CDC guidelines regarding the use of masks and face coverings. In January, the sorority embarked on a Wear a Mask campaign, and in May, we added to this effort by partnering with organizations who provide COVID vaccinations in underserved communities. The 4 components of our chapter's COVID-19 campaign, communicate, educate, participate, and vaccinate, continue to have an impact on families in our communities. We want to empower them with accurate information and encourage them to wear proper face covering and get the vaccine. AKA recently held pop-up vaccination and health shops in Mississippi Delta and in Chicago, Illinois for our COVID-19 campaign. The sorority hosted the Mississippi Health Project 2 and vaccination event for local residents. We partnered with local providers, Walgreens, and the Urgent Primary Care of Clarksdale for a 2-day event that enabled over 300 residents to receive the vaccine. The Chicago pop-up health event provided vaccines and administered COVID-19 tests. The COVID-19 campaigns also includes crucial health screenings such as mammograms, eye exams, and distribution of personal protective equipment. Thank you, Councilor William Parker and Dr. Lindsey Harris, for this opportunity for the Birmingham AKAs to collaborate with you and members of the Birmingham National Panhellenic Council and the Alabama Nursing Association on this very serious matter. Thanks.
Good morning. My name is James Rowland. That's James Roland. I am the president of the Birmingham Alumni Chapter of Kappa Alpha Psi Fraternity Incorporated. Thank you for the opportunity to speak this morning to my family, my brothers, my neighbors, and the community as a whole. The Bible states that God has not given us a spirit of fear, but of power and love and a sound mind. With that, I am asking that you believe that He has bestowed upon us the power and soundness of mind to defeat this disease, and He has given us, please show the love to yourselves and to your neighbors. Get vaccinated and continue to wear your mask. Thank you.
Good morning. I am Deidre K. Diaz, D-E-I-D-R-A, middle initial K, last name D-I-A-Z, and I am the Southern Regional Director of Delta Sigma Theta Sorority Incorporated, covering Alabama, Florida, Georgia, Mississippi, Tennessee, and the Bahamas. I am absolutely honored to stand here with Deltas across the region, DeWanda Nelson, President of the Birmingham Alumni Chapter, Dr. LaToya Bishop, President of the Jefferson County Alumni Chapter, and our student chapter representatives at our colleges and universities. Alexis French from the Ada Nu Chapter at Miles College, Jakira Dial from the Iota Lambda Chapter at the University of Alabama at Birmingham, Taylor Sellers from the New Omicron Chapter at the University of Montevallo, and Raven Omar from the Sigma Eta Chapter at Samford University. The message is clear: if not you, then who? We want to thank Dr. Lindsey Harris and Council President William Parker, and we stand united with the leaders of the D9 organizations and organizations across the city of Birmingham and the great state of Alabama, pleading with you to get the COVID-19 vaccination. The members of Delta Sigma Theta are mothers, grandmothers, daughters, sisters, wives, aunts, teachers, doctors, nurses, community leaders, and more. We also salute our healthcare heroes and those who are on the front line and echo their sentiment with our partnership with the CDC, encouraging you to do your part and go ahead and get the vaccine. In addition to standing united with them, physical and mental health is one component of our 5-point programmatic thrust. So again, listen to reliable sources, and the ladies of Delta Sigma Theta simply came here with one short message. Get vaccinated. Thank you.
Hello, I bring you greetings from Zeta Phi Beta Sorority Incorporated and Phi Beta Sigma Fraternity Incorporated. I am Adrielisa Mitchell, Vice President of the Bessemer chapter here in Alabama. I just want to bring this message to you this morning about becoming vaccinated. Vaccinations are safe, and they are also our keys to help combat this virus. Getting vaccinated may help you and your family from getting seriously ill and help you and help us all to slow down the spread of COVID-19. By getting vaccinated, you are protecting yourself and others. Once again, stay safe, Birmingham, and get vaccinated. Adrielisa Mitchell, A-D-R-I-L-I-S-A, Mitchell, M-I-T-C-H-E-L-L. And thank you guys again.
Good morning. I am Kiwani Alexander, K-E-W-A-N-E-E, Alexander, A-L-E-X-A-N-D-E-R. I am the current Vice President of the Birmingham chapter of the National Panhellenic Council and President of the Birmingham chapter of Sigma Gamma Rho Sorority Incorporated. And you may ask yourself this morning, why get the vaccine? Why not? Do it for your spouse. Do it for your children. Do it for your grandchildren. Do it for your nieces, your nephews, and others. And if none of those are important to you, do it for yourself. COVID-19 has plagued this country, this city, this state for too long. I encourage you, as a member and of the National Panhellenic Council and Sigma Gamma Rho Sorority Incorporated, get vaccinated. Thank you.
I want to thank everyone for their remarks and their encouragement on everyone. Please get vaccinated. If there are any questions from any of the organizations, feel free to ask anybody any question.
Why do you think we're still not seeing people, black folks, why aren't they getting shots now? And are you hearing, are we seeing an uptick a little, or how are you hearing some sort of uptick in vaccine?
First of all, a couple of reasons why I think we're still at a 35–40% range of people being vaccinated. One is a lot of people are sitting on the fence, waiting for others and say, well, we'll let other people take it and we'll check back with us in a while. I think there are others simply that do not want to be vaccinated. And so we need to make sure that we have medical personnel available to answer any and all questions. I think another component, sometimes people, if they hear it from mentors or some influencers within the community. I think that will help. You know, we have a lot more work to go. I think the Johnson & Johnson episode, I think that was an issue. So we're dealing with a lot of misinformation that is out there as well. So I think we've got, you know, it's incumbent upon us to work with all of our community partners, but also work with the media to make sure that we continue to get the message out. Vaccination, vaccination, vaccination. And so that's what you're seeing now, a ramped up effort of everyone collaborating, working together as we move forward to finally, we're at the corner. We have not turned the corner. And I think, you know, over the last couple of months, I think a lot of us got lax on, you know, because we saw the number of individuals being vaccinated kind of dip tremendously. And so we need to just everyone throw the kitchen sink and then some on making sure that we provide the necessary information to make sure everyone gets vaccinated. Sir? They are. The PSAs, they're going to be on radio starting tomorrow. We are doing digital as well as we'll be doing robocalls. Also, we'll be having a Facebook Live tonight. And so we're going to ramp it up. We're going to be working with all of our community partners that you saw here to do a PSA as a group, but we're also going to do more. We're going to be sitting down, working together, collaborating, see what other ideas or what you know, opportunities that we all working together. And you know, this is just the beginning, not the end. And so if there are other organizations or other groups that want to be a part of this, please join us. You know, this is about life and death. And so we're in a race against time to vaccinate as many residents as we can, as quickly as we possibly can. So we're in a race against time. You mean from the city? Yeah, we spoke about that earlier. Currently, there's a proposal for $1.5 million for COVID-19 responses as part of the larger package, the $53 million that's remaining in phase one of the appropriation for the city of Birmingham. I would anticipate sooner rather than later, as it relates to, we have to act, we have to move aggressively. As you know, the city of Gaston and also the State Department of Public Health have provided a TikTok, you know, opportunity, but also the city of Gaston is offering $100 cash contribution or cash for residents that get vaccinated. So we're studying both of those models. We're working with other members of the Birmingham City Council, the mayor's office, to swiftly move a funding package that would include the $1.5 million for COVID-19 responses. And so we need to get it off the ground sooner rather than later. And so we're working around the clock in order to get that, to get those initiatives funded, and also making sure we have the programs in place. But this is about life and death. And so that's what we're going to be impressing upon my colleagues in the mayor's office and other community organizations. You know, and also we got to figure out then, well, what do you know, the incentives for those that have been vaccinated. So we're working through a lot of different components, but the fact that the city of Gaston and the State Department of Public Health have provided some type of incentives, you know, I think that's a model that we can follow. Okay. I'll get her back over here. Is any Dr. Lindsey?
She's right behind the
Okay.
She's behind the post.
All right, Dr. Lindsey? Dr. Lindsey Harris, here's a question for you.
To ask you the same question, Councilman Parker, why do you think there's hesitancy in the Black community? And are you seeing any uptick of late, last week or so, in vaccination in events you might have been attending? We're hearing that. Are you seeing?
So to your first question, you know, you mentioned the Black community. Honestly, it's not just within the Black community, it's within all communities that there is, you know, a sense of hesitancy amongst vaccinations. Why? As President Parker said, I think there's a lot of disinformation and misinformation out there, which is one of the reasons why President Parker provides the platform every other Monday to spread viable, knowledgeable, and great education on the vaccine and COVID-19 from reliable healthcare sources. So I don't think it's just among the Black community. I think it's among all communities. And we just need, our citizens, our healthcare workers to gain greater knowledge of COVID-19 and the vaccine, just so that we can make a more educated decision about being vaccinated. And in regards to your second question, as far as the uptick of vaccinations, in some of the events that I have attended, I have been very encouraged, but we're still far away from the mark, so we still encourage everyone to get vaccinated and stay safe.
Mr. Lindsey with a Y.
It's Lindsey Harris, Harris. Thank you all. Personally, I haven't, but thank you.
You know what? I'm happy. Congratulations, Eli. No better person to be the voice of. He's been the voice of the Roll Tide for years and years, and so congratulations. I looking forward to the G League coming to the city of Birmingham, and looking forward to hearing Eli go. So congratulations to him. So anyway, I think that's all. Listen, thank you all, and look forward to having ongoing conversations. Invite everyone. If you want to carry it live tonight at 6:30, join us on the Birmingham City Council's Facebook page. So we'd love for our media partners to carry that live as well. And we'll be in communication as we move forward on additional opportunities and ideas that we're working with our team. So thank you all.